Welcome back to Morning in America. 20 minutes to the top of the hour. Hope you're on time. According to the CIA's World Fact Book, the United States ranks among the highest for industrialized nations globally for maternal mortality rates. That's a mouthful. Worse than countries like Russia, Kazakhstan, and Malta.
And that's just one of the number of shocking statistics painting a troubling picture on maternal mortality right here in the U.S. Kelsey's here with more on the story. Kelsey.
Mark and Adrienne, according to the Journal of American Medical Association, the number of pregnancy-related deaths more than doubled between 1999 and 2019. So why are some of these groups being hit harder than others? And what can be done to save lives?
It's a national health crisis. A new study shows pregnancy-related deaths are rising rapidly. In 2019, more than 1,200 women died during pregnancy or in the following year. That's up from just over 500 2 decades ago. According to researchers, Black mothers were dying in greater numbers than Hispanic and white mothers. The biggest increase in death rates was seen among American Indian and Alaska Native women. I sat down with OBGYN doctors Jamil and Idris Abdur-Rahman to find out what's behind this troubling trend.
First of all, it's an access to care. They're not getting care sometimes at all. They're not getting timely care. They're not getting consistent care. And so it's an access to care. There's also a lot of pre-existing conditions that you see in minorities that you don't see in other people. So these are pre-existing conditions that make them more prone to developing complications that can lead to bad outcomes.
So we're talking like diabetes, hypertension, things like that. So it's not being treated well or at all prior to pregnancy. And then during pregnancy, because of all of the physiologic and hormonal changes, it gets worse.
Medical experts say maternal mortality has little to do with a person's socioeconomic status. Even track and field star Tori Bowie couldn't outrun the epidemic. The 32-year-old Olympian died in May this year from pregnancy-related complications. Despite having one of the most advanced healthcare systems in the world, the U.S. still has the highest mortality rate among other wealthy countries. So how do we as a nation address an issue that is in most cases preventable?
The solution is it's going to be funding, number one. So I'm speaking to our government leaders. It's going to be proper funding for education, funding for diet, for research, for nutrition, for healthcare. It's going to come down to funding and money. We've got to put money in the right places in a sustained manner. It's just that simple.
And then I also think we need to train healthcare providers, doctors, nurses, physician assistants, nurse practitioners to listen to patients, because we all have this subconscious bias that we bring into our interactions with patients. And so we tend to, again, think, you're pregnant. There are a lot of complaints associated with pregnancy anyway. We tend to not pay attention to what patients are telling us.
And while this study was conducted pre-COVID, the doctors tell me growing distrust in healthcare professionals during the pandemic meant that patients were less likely to seek medical care. Adrienne and Markey.
All right, well, a good thing to just call attention to so that women can be more aware of taking care of themselves, show more initiative, because
all hands on deck.
You've got to take control of your own, you've got to advocate for yourself. You've got to take control of your own health. And at the same time, doctors and nurses who care for people need the training as well. Still ahead this week. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.